Wake up. It's the Sleep Unplugged podcast, episode 83 Brain Fog and Sleep. There's someone in my head, but it's not me. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I am a neurologist and sleep specialist and your host for an episode of the podcast I've been looking forward to because ever since the term brain fog emerged from the mouths, I should say, of my patients, it was kind of one of those things where I was asking myself the question, did I miss something? Is this a fully formed medical term? Or did everyone just start using this term at the same time, which is not something that typically happens? Not a lot of people just come up with the same sort of name. They may have the same constellation of symptoms, but coming up with the same name for a feeling, a symptom, a disorder is unusual. So I was really interested to dive into brain fog and sort of look at the relationships between it and sleep. So really looking forward to this episode. Before we get started, if you're interested in the show, want to talk about your own battles, dealings, solutions to brain fog, or anything that we've talked about on the show, you can reach us here at the Sleep Unplugged podcast through social media. That's Dr. Chris Winter Twitter, Dr. Chris Winter Instagram, Dr. Chris Winter TikTok, Threads, Bluesky. We have a Sleep Unplugged page on YouTube. You can find all the posted videos that we've of our podcast. So we've just posted episode 82 about exploding head syndrome. So I'm very excited about this. If you go to the YouTube page, you can subscribe to it if that's your thing. But if you go there and look at all the 83 videos now that we've posted via our podcast, so all the podcasts get posted as videos. And if you go to the little video sections and you just click videos and then say most popular, by far and away, the most popular is our episode on cataphrenia. At the recording of this podcast, 4,555 views. That's first place. In second place, I think the video has 355 views. So by more than a margin of 10 times more popular, cataphrenia blows everybody away. So, as I mentioned in last week's podcast, there was a theory by a certain nurse practitioner in Florida who said, I bet if you did an exploding head syndrome, it could be similarly popular. So here we go. We just uploaded the exploding head syndrome video on YouTube. You can follow it on there to see if it can race up through the ranks or if there's just something special about the cataphrenia episode. I like to go do comments, corrections, criticisms quickly. There was a correction that I found from last week's podcast about exploding head syndrome. I mentioned that the female to male ratio was 1.5 female to 1 male. And then I gave an example. And then I said for some reason, so if there are 3 women that have exploding head syndrome, then 2 would have, and that's or no, I'm sorry, if there were 3 women that exploding head syndrome, that means 3 women to every 1 man, and of course that makes absolutely no sense. It would be 3 to 2. So I did a little mental math error on that podcast. I'm not sure how, but that can be pretty much on brand sometimes when I'm talking. So wanted to correct that. Darren wrote in and said, you're pretty hard on rattle and hum. I think without rattle and hum, there would have been no Octung baby. So, Darren, I appreciate that. I will say I was not being hard on rattle and hum. The critics were pretty hard on rattle and hum when it came out. I think it's a great album. Like I said, we talked about Hawk Moon and God Part Two. What's the very last song that closed the it'll come to me. Beautiful song. There was the very last song um, on the album, but I agree. I think that because of the backlash that they got from the recording of Rattle and Hum, they really decided to take their music in a very different direction. So I agree with you. I'm glad they recorded it. I like the album. I'm glad they went in the direction they did. And finally, I'm going to mention another listener. I'm going to call her Sarah. I just don't want to give her real name. Sarah wrote, I've been struggling with some sleep issues on and off for about 15 years. Normally, I would have one bad week every 5 to 6 weeks, trouble staying asleep, but never falling asleep. And she said, recently I started having trouble falling asleep and tried all kinds of things, CBTI, visited with two therapists, and just nothing was working. She was at her wit's end. Do you have any recommendations for somebody that could see me? Because I unfortunately cannot make it to Virginia so that you could legally see me. And then she said at the very end, she signed her name on the email and then wrote, but man, I don't need TV when I got T-Rex. And I thought that was pretty awesome. So that's from the Mata Hoppel song, All the Young Dudes. It was actually written by David Bowie and probably salvaged their career. This was an older group that a lot of people who were Mata Hoppel fans really liked. They'd kind of tinkered around, kind of went, in a lot of different directions. We're about to hang it up, and then David Bowie said, "Hey, you can have this song Diamond Dogs," and they were like, "Yeah, it's not really kind of our thing." And he said, "Oh, well, you could have this song. It's called All the Young Dudes." And it really changed the direction of their history forever. And it's an awesome song. So I appreciate that, Sarah. Oh, is that concrete all around, or is it in your head? It's not in your head, Sarah. There are people out in California who can help you, and I emailed her some names of some people maybe could help. But if you ever find yourself in Virginia, or if anybody out there needs help who are in the Commonwealth of Virginia, give us a call. We're happy to help. So this week's episode, brain fog and sleep. There's someone in my head, but it's not me, from the song Brain Damage by Pink Floyd. This was their 1973 album, Dark Side of the Moon. This is the next to last song on the album, written about Syd Barrett, their bandmate, who, because of significant mental health issues, left the band. Really, the entire album. People think of Pink Floyd concept album, they go right to the wall. Dark Side of the Moon was a concept album too, about the different psychological struggles that they felt when they were, on the road touring, playing in their band. And they even mentioned, and if the band you're in starts playing a different tune, I'll see you on the dark side of the moon, which is where the title of the album comes from. And that referred to the fact that when Syd was really struggling, he would often start playing songs that the band was not playing when they were performing. I just recently saw a group called Classic Albums live. If you ever have a chance to see them, they're amazing. They performed the entire album, Dark Side of the Moon, note for note, perfectly. I saw them up in Clearwater, Florida around New Year's Eve, and they were just tremendous. And they do a couple albums and perform like Sticky Fingers and Dark Side of the Moon. So if you ever have a chance to see them, go to it. It's well worth your time. So let's get into brain fog. I was looking around for a really good medical definition, and almost every reference that I saw, and there's not many, basically said there is no consensus definition for what we're talking about when we're talking about brain fog. So I think that to the best of our ability, and there's a great article that was written in like the Emory Medical Magazine, if you look it up back in 2023 about brain fog. I can't remember the name of it. I should have written it down. That really was a nice consensus sort of layperson article about brain fog, which was kind of interesting. But when you pull from a different bunch of different sources, what you get is sort of a nebulous constellation of symptoms that generally involve something related to concentration or focus, something typically related to memory and your ability to recall information. There is generally some sort of component of low energy or fatigue. And I know we've talked about that a lot on the show in terms of what's the difference between sleepiness, what is the difference between fatigue. This often has a much bigger fatigue issue to it, although the idea that you would see brain fog in somebody who's struggling with sleep disorders, something like narcolepsy or sleep apnea, is certainly something that we see. Other interesting kind of unique descriptions of brain fog include number one, feeling like there are bad connections in your brain. So if your brain's some sort of circuit board, the transmissions are not getting through the circuit. The circuits are kind of broken up. They're, quote unquote, bad connections. The other thing that people talk about are thoughts disappearing. Like I walked into the room with a piece of paper and a pencil and I can't remember at all what I've come here to do. So those things may give us a little bit of a framework in terms of what we're talking about when we're discussing brain fog and what that necessarily is. I'll throw one more thing out there, and this will become a little bit more important when we talk about fibromyalgia. In some individuals, there seems to be a bit of an element of pain that goes along with that too. In other words, there may be some sort of somatic or physical manifestation of individuals who have this. So brain fog, where did it come from? There were connections that we'll get into the history in a little bit in terms of brain fog was sort of first described as far back potentially as the 1850s by a British physician named James Tunstall. And he sort of talked about this condition related to individuals who he would call brain workers. So if your work was academic, rigorous, a lawyer, a philosopher, a mathematician, certain types of students, that overworking your brain or your mind would lead to this mind fatigue without a lot of body fatigue. And I was reading that description and I was thinking about the SAT, or in my case, I remember taking the MCAT. I took it once, thank God. So these are everybody, everybody has their own. I've got a uh my daughter's boyfriend's getting ready to take the GMAT. Whatever your field is, there's some big standardized test that you've got to take. If you're going to re-credential as a neurologist, you have to take this test, if whatever. So you go to the testing center and they pat you down to make sure you don't have, hidden notes or secret things and then you go into the little carrel and you're just there for like 6 hours crushing these questions in biochemistry and anatomy and physiology and whatever you're doing, math. And that way you feel when you walk out of the standardized testing center, you literally haven't moved anything except your right hand on the mouse or the, writing utensil. But you feel like you've gotten blown over by a Mack truck. And, I always talk about sleep in terms of we stress exercise a lot on the podcast. If you go out and exercise, you create a lot more adenosine, and that has a feedback of making our homeostatic drive to sleep greater. I don't think it's just physical activity that does that. I think concentrated cognitive activity or brain work can do it as well too. So this goes back a long way, and there's a similar sort of connection with individuals who develop fibromyalgia. So fibromyalgia is an equally kind of obscure, cryptic, difficult to, it's like grabbing onto, vapor, how to grab onto this condition, which is very real. Lots of people have fibromyalgia. It's just sometimes hard to kind of understand exactly what's going on with it. And a lot of people with fibromyalgia would describe themselves as having fibro fog. So that was a term that we heard a lot of. And then COVID happens. And by far and away, one of the most common side effects of COVID, both when you had it, but more commonly after COVID, was this brain fog. And it's thought to affect, somewhere around a quarter of individuals who have COVID. So there was a 2022 Journal of Translational Medicine study called Brain Fog of Post-COVID-19 and Chronic Fatigue Syndrome. Are these the same medical disorder? So they were looking at patients with chronic fatigue syndrome and basically saying, look, these individuals often have a lot of memory problems, attention problems, word finding, words escape them, reasoning difficulties, cognitive concentration problems. And the most prevalent cognitive deficits seem to be lower processing speeds and worse verbal attention, lower sustained attention. So those kinds of things where think of that circuit board where everything has just been sort of slowed down. That transmission rate of data crossing synapses feels slow to these individuals. And it's thought that these deficits are probably present in around 40 to 50% of people with chronic fatigue syndrome. And their inability to concentrate and thought slowness has been defined as being either fibro fog, brain fog, chronic fatigue syndrome fog. Um, and these symptoms seem to be due to a lot of different factors. And the theories put forth in this paper say, well, could there be sort of an autoimmune abnormality here? Are there antibodies that are affecting something in the brain that are creating this slowness? Is there some sort of breakdown of the blood-brain barrier? Is this all related to neuroinflammation? This study really kind of dived into this and also tried to parse out the pieces of depression and anxiety that's almost always present in these individuals who have these kinds of symptoms. So when we go back to typical brain fog, so an individual says, look, I don't have fibromyalgia, I don't have a pain component to this. Whether or not have had COVID or not in the past, I'm not sure, but this doesn't seem to be temporally related to the condition. What is thought to cause brain fog? So when you look at brain fog, we've already talked about several: chronic fatigue syndrome, we've talked about COVID, and we've talked about fibromyalgia. Others that sort of are implicated, the one that you come across almost constantly in any sort of discussion about brain fog is stress. So, and I see that a lot in my individuals. Now it's a skewed population, right? So you don't see a lot of individuals who are like, look, I've retired, I spend most of my time traveling, and just suddenly developed a lot of brain fog. It's mostly in the young, busy professional with 3 kids, and they all play travel sports. You do see that sort of pattern emerge a lot. Lack of sleep is also really at the top of the list of individuals who describe brain fog and brain frog, brain fog, and that doesn't make a that shouldn't make anybody too terribly surprised. But when we think about what are the effects of inadequate sleep, certainly sleepiness is one of them. But I think that individuals, particularly individuals who are telling you, look, I sleep 5 hours at night and I'm good to go. I think those individuals can often struggle with brain fog, meaning the excessive sleepiness or that drive to sleep is not pushing them quite to the point of wanting to sleep, but their brain is not functioning on all cylinders. And we know this. We know that physically and cognitively, we're not performing at our best when we're not getting adequate sleep. So perhaps brain fog is the ability for some people to feel that versus others may not. Again, we always talk about Jenny trauma surgeon. Maybe Jenny trauma surgeon doesn't feel it. She's busy enough running around, stopping bleeding, saving people's lives, being the hero in the surgical suite, where she's not necessarily feeling, when I'm actually doing the surgery, I don't feel like things are connecting as well as they could. It's like people who tell you, I can drink a whole pot of coffee, Chris, and it doesn't affect my sleep. Well, I'm almost certain that it does. That if we were to set up an experiment of drink this entire pot of coffee, now go to bed, we'll monitor your sleep for 2 weeks. And then the next 2 weeks, you will not drink the coffee, we'll monitor. I bet we'll see pretty distinct differences. Now, it would be interesting to see of the people's differences, how many people actually perceive them. So, in some ways, brain fog might be an individual's ability or a measure of their ability to feel the dysfunction that goes along with lack of sleep or stress. Some others, inadequate exercise. One of the most common things, and we'll talk about ways to overcome brain fog, is to not only exercise, but to build in regular movement. Yeah, I noticed that there's a trend in terms of using timers now, little, kitchen timers like you used to use to make your 6-minute eggs or whatever. So you dial it to 20 minutes, set it on your desk, and you study your political science. And when the ding happens, you get to go do something fun or play a game on your phone or look at some cool videos, or you take a jog or go exercise, go to the weight room. I know that seems to be, let's go blow off some steam and get it out, and then we'll set the timer for 20 minutes, sit down and focus. Then a lot of people think you can't really focus more than 30 minutes at a time, so you're kind of capitalizing on this. Depression, anxiety, illegal and illegal drug use, alcohol, insomnia, aging, jet lag, Lyme's disease, antihistamine use, lupus, hormonal changes during pregnancy, too much screen time, and a big one is menopause. One of the most common relationships between brain fog and medical conditions seems to be menopause. So that's another big one too. It doesn't have like a menofog. It doesn't have a great name that's been coined, that like fibrofog. So menopause is another big one too. So what is really going on here? What's the pathophysiology? I mean, we can see, I mean, patients will tell you what it is. It's like my brain wiring has come unglued. They've got ideas of what it feels like, but truly what's happening here. It was a study in 2014 by Andrew Miller, who basically showed that patients with chronic fatigue syndrome may have reduced responses compared with healthy controls, primarily in a region of the brain connected with fatigue. So patients with chronic fatigue syndrome had less activation of what we call the basal ganglia, which is sort of a deeper structure of the brain stem. And they were measuring this with a functional MRI, often called fMRI. So in individuals who were complaining of brain fog, there seemed to be a lower functional capacity of the basal ganglia in those individuals versus individuals who didn't. So at a functional level of the brain, there may be regions that are not firing as appropriately in brain fog patients as patients who don't have it. And it's this kind of research that will eventually sort of unmask what it is that people talk about. It drives me crazy when you talk to clinicians who sort of poo-poo things like fibromyalgia, or they poo-poo things like brain fog. And they'll often say things like, it's not a real thing. And I think we have to be very careful when we say it's not a real thing versus it's not a medically defined thing, or even a medically understood thing. You know what I'm saying? So um, just because we don't understand it doesn't mean it's not real. There are a lot of things in this world that I do not understand, but doesn't make them any more or less real. You know what I mean? Like half the stuff my kids watch on television, like, I try to be like, hey, what's going on? Oh, you watching this? Oh, I'll sit down and watch with you. Like, what is this show you're watching? It doesn't make any sense. It's not good. It's poorly acted. It looks like somebody's making it with their cell phone. And they're like, yeah, it's super popular. It's, millions and millions of people watch this show. And sure enough, you look it up, there's a lot more people watching that thing than my parasomnia video. I don't understand it. I don't know what people are getting out of it, but it's real. It's very real. And I think we as clinicians sometimes tend to marginalize things that we don't understand or have not been formally defined. And you know how I feel about formal definitions of things like insomnia. They don't make a lot of sense. They're not often particularly necessary. I mean, you can do it if you want to. If you want to formally define brain fog, go right ahead. But it's going to be, to some degree, different for every patient. And I think we have to think of the patient, not the formal definition first, because patients are really struggling. And when you are a neurologist and you're dealing in sleep, or you're a psychiatrist and you see one patient after another complain of the same thing in almost identical terms, of course it's something real. You just don't know what it is, and maybe more importantly, don't have a great plan for making it better. So, anyway, how do we assess individuals who might have brain fog? There was actually a paper, I believe it was in 2023, called Efficient Assessment of Brain Fog and Fatigue, Development of the Fatigue and Altered Cognition Scale. So this is a little bit different than a scale we talked about, I believe, during the sleepiness versus fatigue episode. the fatigue severity scale, the FSS. This is the FACS, and there's 20 items. And there is a degree of similarity between these two scales, although this scale is sort of divided into the fatigue scale, which is 20 questions, and then the altered cognition scale, which is an additional, I'm sorry, there's 20 questions total. I believe it's 10 and 10. Sorry, I'm looking at it in the wrong way. So the 10 questions about fatigue are: I felt fatigued. I felt alert. I felt worn out. I felt sluggish. I felt run down. I had the energy to do what I wanted to do. I had to force myself to get things done. I felt tired. I had to struggle to finish what I started to do. And I had problems feeling energetic no matter if I slept or napped. So that's sort of the general gestalt of the questions that are being asked about energy and fatigue. Now, they have a separate bank of questions looking at altered cognition. I lost track of what I was going to say. I was forgetful. I had trouble concentrating. I had trouble focusing on things I wanted to do. I was easily confused. I felt, quote, spaced out like I was in a fog. I was clear headed. I didn't process things as quickly or accurately as I should have. I had trouble paying attention, and it was hard for me to make up my mind and reach a decision. So those are the questions on the scale. And so they're working on trying to develop a way that you could not only classify people as maybe potentially having brain fog or not, looking at the relative severity of it, and maybe looking at the relative weight of, is this more of a fatigue sort of picture in an individual, or is this more of a cognitive de debilitating symptom problem in individuals with brain fog? So, what do we do about it? Okay, great. We have brain fog and we've talked about it. I think that what kind of sleep specialist would I be if I didn't say, make sure your sleep is great and adequate in both terms of quality and quantity. I think that's really a step one. Um, and an easy one. It's an achievable one, I think, if we look at that. So I think that's a really important thing. The second thing is setting limits. I often find individuals who are pushing themselves beyond where they should be. They're sick. They're not giving themselves an appropriate amount of time to get better. They are pregnant. They are working two jobs. I think that for a lot of individuals, that overworking of the body and maybe even overworking of the brain can have consequences to some people. So I think it's okay to create limits for yourself, which is I think is very important. Um, in addition to sleeping well, we want to exercise, we want to make sure we're eating well, and we want to be mindful. All the four pillars of health that we can control. We always talk about the four tables. The legs of the table are sleep, get good sleep, food, eat good food, eat healthy food, exercise. You want to exercise a lot and appropriately, and be mindful of your cognitive state. Take time, relax, meditate, etc. Um, we talked about the timer, making sure that you're giving yourself an adequate amount of time to take breaks. And often it's recommended that individuals who are struggling with brain fog, every now and then when you're at work, get up from your desk, take a walk around, go visit with your neighbors, especially the neighbor down the way who's got, candy at her desk. Go down there, take a piece of candy and see how she's doing, how her week was, how her kids are doing in school, and do they enjoy their snow day, and then go back to work. So you take little field trips during the day, I think would be a really good thing to do. Manage your stress in appropriate ways. That's a really important one, I believe. And then finally, I think that looking at other aspects of your medical situation. Cardiovascularly, are you good? Is your blood pressure where it should be? Have you seen your primary care doctor for a routine physical? So a lot of times when we look for causes of brain fog, they can be found in medical problems that we are either unaware of at that point, or things we're not dealing with sort of head on. And in that vein, I think that, if you're somebody who struggles with depression and anxiety, being more aggressive about the treatments of those in whatever way that is for you. If that's, medical treatment, if that's talk therapy, if it's, whatever your treatment is, I think being aggressive and open about that could be really helpful as well too. So brain fog is an emerging entity, but I think it's been with us for a very long period of time. And the longer, I'm in medicine, the more I see conditions like fibromyalgia, chronic fatigue syndrome, COVID, and other things that create that same sort of phenomenon. It's kind of like lots of things, viruses, bacteria, walking out of a warm house into a cold building, running, exercising. Lots of things can cause a runny nose. You know what I mean? Even a CSF spinal leak will make it look like fluids coming out of your nose. So there are lots of ways to have sort of a particular symptom. And I think we need to start thinking about brain fog as perhaps a common final symptom that can have a wide range and host of conditions. We need to stop dealing with it as if it doesn't exist, embrace it in our patients as an actionable item, and really help them find ways to deal with it. And again, I think it all starts with great sleep. So that's it. We will wrap this episode up. If you'd like to talk about your own history with brain fog, things that have worked well for you, frustrations that you see in the medical community, Dr. Chris Winter Twitter, Dr. Chris Winter Instagram, TikTok threads, Bluesky. If you want your name left off of something, let me know. I generally do that anyway. I always ask permission of individuals before we do it. We'll post this eventually on the YouTube Sleep Unplugged page. And until next week, sleep well.